Coming to infections in pregnancy is most frequently asked topic both in PDCC as well as in FET conducted by NBEMS. So, coming to rubella. What is rubella? Rubella is a condition or a disease that is caused by a virus known as rubella virus. It is also known as German measles and caused by RNA virus. It is one of the most teratogenic infection seen in pregnancy. Mild disease occurs in mother while teratogenic effect occurs in the fetus. Now coming to congenital rubella syndrome. So what is congenital rubella syndrome? Now look at this image. This figure is showing congenital rubella in the baby. So can you see this baby? Can you look at the eye of the baby? Can you see a pipe that is going through the nostril of the baby? It is nasal pipe supplying oxygen. And can you see this face? This is blueberry muffin rash that is associated with congenital rubella syndrome. There is association with PDA or patent ductus arteriosus. So here the ductus arteriosus is patent. And the classical triad, and here you can see a cataract. Yeah. So the classic triad that occurs in rubella is patent ductus arteriosus, cataract or deafness, and blueberry muffin rash. So this is the classical triad in congenital rubella. Congenital rubella occurs when rubella infection occur in pregnancy and it is an acute infection. The earlier the fetus is infected, the more serious is the disease, may result in serious congenital anomalies like fetal growth restriction, hepatosplenomegaly, cataract, mental retardation, sensory neural hearing loss, PDA, pulmonary stenosis, and thrombocytopenic purpura. So the classical triad that is seen, I am repeating again, it is SEC. SEC means S for sensory neural hearing loss, which is the most common. Eye defects includes cataracts and retinopathy, and one of the most common congenital heart diseases, that is PDA, is also seen in this condition. Other features include microcephaly, means small head, IUGR, hepatosplenomegaly, blueberry muffin rash, and thrombocytopenia. Now, based on gestational age, the risk is around 90% if it occurs in the mother at gestational age of less than 10 weeks, and after 20 weeks minimal or rare infection. Most dangerous period is first trimester because there is embryogenesis, there is formation of all the organs that occurs in first trimester, and if the infection occurs in first trimester, then congenital malformation may occur. And if it occurs late, then risk to fetus is almost negligible. Now coming to maternal features, as this is a viral infection, so the patient may come with fever with rash. Rash can be maculopapular, that starts on the face, and there is post-auricular lymphadenopathy also. Arthralgia or pain in the joints can also occur, and many infections are subclinical. So if there is recent infection, then when we do titers of the patient, then we can see rubella IgM, which indicates recent infection, and rising IgG titers can also be seen. In fetus, we can do PCR for the from the amniotic fluid. Fetal ultrasound can be done to look out for IUGR and anomalies. So what is the management? If the infection is confirmed at gestational age less than 10 weeks, then we offer the patient medical termination of pregnancy, because here there is high risk of congenital rubella syndrome. At 11 to 20 weeks, detailed counseling and anomaly scan should be considered, and if gross congenital anomalies are noted in the anomaly scan, then we can offer the patient amniocentesis or chorionic villi sampling based on the gestational age of the baby. At more than 20 weeks, we usually reassure the patient as there is low risk only. Now, for prevention, we can give MMR vaccine. MMR vaccine covers mumps, measles, and rubella. It is a live attenuated vaccine, so it cannot be given in the pregnancy. It is contraindicated. It can be given in the pre-pregnancy period or the postpartum period. And patient is told to avoid pregnancy for 1 month after vaccination. Now, the most common CRS feature is deafness. Most common cardiac defect is PDA. Most sensitive period is less than 10 weeks. And vaccine is live, hence it is contraindicated in pregnancy. Now, there are certain things that I want to tell you, That the path of infection is that the virus enters through respiratory mucosa, infects the cervical node, and there is hematogenous dissemination. So the chances is high when there are school going children who are in crowd places, and when some pregnant female come in their contact, then this infection can occur. So occupational history is very important. Occupational history like teacher or pediatric nurse. So what is the vaccine name for rubella vaccine? Can anybody tell? Yes, we have already read. It is a live attenuated vaccine, and the strain we used in MMR vaccine is RA27 by 3. Thank you.